Today's topic in pediatric health series is behavioral problems which are found in a children. Behavioral problem is defined as a behavior or a pattern of behavior which is uncommon, disruptive in nature, which affects their health, their social life, at school, at home. They are having a different kind of behavior which affects their health at a very great extent. Today I am going to explain the first topic in behavioral disorder, which is anorexia nervosa and
Bulimia nervosa.
First I am going to explain is anorexia nervosa. Anorexia nervosa, it is an eating disorder which is characterized by having a body weight which is less than 85% which is expected for their particular age and for particular height. Here the patient having a fear of gaining weight in spite they are underweight. In postmenarche girls, they suffer from an amenorrhea. Here what the patient do to lose the weight? For losing the weight, they usually follow the strict dietary restrictions. Secondly, they increase their physical activity or they use laxative, purgatives or diuretic. Profound weakness which leads to hypothermia, hypotension, edema, which is independent edema, bradycardia and metabolic changes. There might be development of hypokalemic metabolic alkalosis due to excessive vomiting and use of diuretics and purgatives. Usually anorexia is associated with depression, anxiety, social issues, suicidal tendency and having some OCDs, that is an obsessive compulsive disorder. Person is suffering from anorexia nervosa. There is a need of psychotherapy. Psychotherapy, it includes individual therapy, group therapy or as a family members, like all the family members will get a therapy to acquire a proper eating patterns and they can restore the perception of proper satiety and hunger. Not only that, in some cases there is a need of nasogastric or parenteral nutrition, but in most cases oral feeding is assured. There is a need of nutritional rehabilitation program to achieve a proper weight for their particular age and height. Bulimia, which is defined as the person having a habit of binge eating. Binge eating is defined as they eat a large quantity of food in a short period of time, which is very much uncommon from a normal individual. And after eating a large quantity of food in a small period of time, they follow compensatory mechanism to avoid weight gain. By inducing the vomiting, there is a use of laxatives and purgatives. By fasting, by using the enema or increasing the physical activity. Here there is also associated with the depression and suicidal tendency. Binge eating and the compensatory mechanism both follows like for a twice in a week and it follows for a 3 months, then it can be diagnosed properly. Along with that, it is associated like that the body shape and the weight of the child or the girl will be inappropriate. Here there is a need of psychotherapy along with some medications is required.
Behavioral disorder, in which I am gonna discuss about pica and food fussiness. The first topic is pica. Pica is the persistent ingestion of non-nutritive substance such as plaster, charcoal, paint, earth for at least 1 month in a manner that is inappropriate for developmental level. It is a common problem in children less than 5 years of age. Factors speculate to predispose to pica include mental retardation, psychosocial stress, and other behavioral disorders. Poor socioeconomic status, malnutrition, and iron deficiency are commonly associated with pica, but their etiologic significance has not been established. Children with pica are at increased risk for lead poisoning, iron deficiency, anemia, and parasitic infestation. Management comprises behavior modification, alleviating the psychosocial stress if any, and iron supplementation if deficiency is present. Second part is food fussiness. Food fussiness, it is like a common problem in young children. In other words, they are very choosy. They eat particular food they liked. It is often reflect that excessive need for control on this part of the parents about what the children eats. Management includes examining the child for any nutritional deficiency and counseling the parents regarding the normal growth pattern and dietary requirements of children. Useful behavior strategies include establishing regular meal timing, ensuring a pleasant atmosphere, offering a variety of foods, and setting an example of enjoying the same food themselves. Offering small servings at a time, not to force feed the child, presenting the food in an interesting manner, and praise for good eating behavior are other helpful strategies. Parents should resist the temptation of offering sugary or fatty snacks as substitute or reward for eating healthy food.
Topic in Paediatric Health Series is the part 3 of behavioral disorder, in which I am going to discuss difficulties with toilet training, temper tantrums, breath holding spells. The first topic is difficulties in toilet training. Here, the child will refuse to defecate in the toilet, which leads to development of constipation, and it will ultimately produce a frustration at a parent's point and a stress in the children. Here, what is the issue? The parents will start to train the child before the particular age group. They should be trained when they are after the 2 years of age, when they can indicate the fullness of bladder and fullness of bowel, and they can follow particular instruction. Use of toddler seats to be done, that can be placed on a normal toilet seats. The ambience should be conducive to the learning and free from the pressure. The positive approach from the parents and the consistency to be maintained so that we can attend a normal pattern. Next topic is temper tantrums. Here the child faces the challenges which are on physical and emotional level. They draw the attention towards himself. It can include yelling, crying, hitting the objects, throwing the objects, head banging. Here usually it develops when they cannot perform autonomy or a complex task by themselves, and they cannot communicate because they have a limited verbal skill at that time. It can subside by the age of 2 to 3 years, but it is most profoundly found in an age group of 18 to 36 months. In temper tantrums, the parent should be asked to list out the situations where this disruptive behaviors arises, and they should try to avoid it. The parents should ensure that the child is well rested and has been properly fed. While going out, they should carry a proper snacks for that particular period of time. Not only this, they should have a proper calm and stir behavior, firm behavior at that particular time, so that the child cannot take the advantage of this particular situation. Here, the child should be easily distracted at an early stage, or they should avoid this situation. The child should be protected from injuring himself. A timeout is needed where the child is asked to stay alone in a quiet and safe environment, which is quite useful in this condition. Next topic is breath holding spell. Breath holding spell is a reflective event that is initiated by certain provocative events that causes anger, pain and frustration, so the child will cry. There will be the crying at the expiration will stop. They will produce an apneic and cyanotic or a bail. If breath holding spells continue for a few more seconds, there will be tonic-clonic seizures. In some cases, the child may turn into unconsciousness, and there will be hypotonic and child will fall. Breath holding spells are peak at the age of 2 years, but it is very unknown at 6 months of the age and abate by 5 years of the age. Breath holding spells usually subsides by its own. After few seconds, the child may have a normal activity, or they might sleep for few seconds.
Based on the setting and the typical sequence of crying, cyanosis or pallor, with or without brief loss of consciousness. Here, the differential diagnosis we can include like seizure, cardiac arrhythmias or brain stem malformation.